Hi, I'm Carissa. I'm going to be your CNA today. We'll start with our hand hygiene. We'll pull our privacy curtain. Today I'm going to be giving you some peri care. This is Mrs. Johnson. I'm going to go grab my supplies. So here on this table we have my gloves, a Chucks pad, soap, a basin that I will fill with comfortably warm water, and 6 washcloths. And if you see anything during your state test that you do not have, please let your state test observer know. Let me go fill this up with warm water. I want to check the temperature. Make sure we're not giving our patients cold water and also not scalding hot water. And we will take all this with me. Okay, make sure I don't hit myself on that. We'll raise our bed to comfortable working height. We will flatten the bed, Mrs. Johnson. We'll make sure our bed is locked for safety. I'm going to move this a little bit by unlocking and scooting over. Relocking. Making sure our privacy curtain is closed, even though we did that. And only exposing the area we are going to clean. So by doing so, we'll just slightly raise the gown, slightly lower the blankets, and we'll start with getting that one wet. And before we wash, I'm going to place a Chucks pad and ask my state test observer if she can come stand on the side for safety. And they should be holding your mannequin only after you push them over. So we'll put the Chucks pad, and you can either walk over to the other side and do the same thing, or you can pull them and pull the rest. It's up to you. Whatever's easiest. Okay. Thank you, Mrs. Johnson. We'll take our first washcloth, and we're gonna fold 4 corners. So folding it in half and then half again. We'll take our soap, make sure we're actually putting the soap on each petal of the washcloth. We don't want to pretend, we want to actually do, even though we're doing this on a mannequin. And when we get to the female peri area, we want to make sure we verbalize we're separating the labia, and we want to go from front to back. So that would be side down, clean area on the washcloth, the other side down. And on a mannequin, sometimes it could be hard, so verbalizing is super important. Continuing to separate the labia and going down the middle. And if you wanted one more with your clean petal, you can definitely do so. If not, 3 is fine. We'll put that in the laundry basket. We'll get a rinse again with the petals. We'll go, down the side, separating the labia, down the side, and down the middle. And dry. You can do it the same way, or you can pat, whatever is easiest for you. And then make sure your test observer is still on this side, so we can do the same thing with the back. So as my state test observer, we'll grab the mannequin after I pull him over, or her over. Sorry, it's really heavy. Again with the soap on all 4 corners. 3, 4. And front to back on our mannequin here would be front to back. And this again with the side, front to back side, front to back middle. and you can do it a fourth time if you'd like. I'm going to stick with 3. Rinse the same way, side, side, and the middle. And then we can dry. Side, side, middle. And here, while they're still holding the mannequin, I like to take the Chuck's pad out so I don't forget. And put her down. Pull the Chuck's pad out. Put in our trash. And cover our patient back up. We'll get her back to a comfortable position. Here's your call light, Mrs. Johnson. Here's your water. I'm going to go dispose of my equipment after I lower the bed. We're going to dump. And then we're only rinsing. We're not washing. We're just rinsing. And we're drying. And then we will return to storage. Take off your gloves. Hand hide. Oh, nope, we're washing our hands with the skill. And then we'll wash our hands.